Welcome everyone to this our third webinar for the Global Indoor Air Quality and Respiratory Infection webinar series. My name is Prashant Kumar, so I'm a professor and chair in air quality and health at the University of Surrey. And I have two of our speakers today from Bangladesh and India. But just to start with some housekeeping notes. So this webinar is being recorded, and we will make it available to our colleagues, whoever is interested later on. So you can watch in case some of the colleagues are interested to have a look later on. And then if you have the question answers towards the end, we'll take those. So please use the Q&A button on your screen and put these questions there. So I will read those questions for you. You can put your name and the place if you want me to disclose them to our speakers. So what I'm going to do is just to really start very quickly to give a quick overview of this webinar. So this is a webinar which is done as part of a project which is called the Knowledge Transfer and Practical Application of Research on Indoor Air Quality. And this is funded by the University of Surrey's EPSRC, a part under the ODA or the GCARE, the kind of funding there. So the idea of this project is to develop a knowledge exchange platform across the ODA countries with the aim to share and discuss the state-of-the-art practices on indoor air quality and respiratory infection. We have 12 ODA countries involved in that. So that includes 13 cities, with over 12 PIs from each of the cities, and there are over 40 early career researchers, including postdoctoral researchers and the PhD students and so on. So this basically builds upon the work we have been doing as part of the previous the two projects. So the first one was called the CARE cities. So there are the partners here. You can see, so this is covering the four different kind of the continents. So the Southeast Asia, where we have India and Bangladesh and China. Then we got the Middle East, where we look into the Egypt and Iraq in Kurdistan. And then we have the Latin America with Colombia and Brazil. And then Africa, where we got 5 countries included in there, which includes Ethiopia, Kenya, Tanzania, Malawi, and Nigeria. So, so the work, so you will see actually that the previous two webinars, they were covering, they were covered by the colleagues from the Latin America. So this time we have the colleagues from Southeast Asia, and then you will see the upcoming webinars actually covered by the other colleagues there. Yeah, so as I mentioned earlier, so that we had like two background projects there. The one was called the Clean Air Engineering for Cities. So we looked into the in-car aerosol exposure there. And then we have a follow-up work where we looked into the homes. So we are still working on this, this project. So we got the data collected across 12 cities in the homes of the low-income, the housings. So there will be more work actually, you will see at some point there. So today, as you see, we got two of our speakers from India and Bangladesh, and then these are the forthcoming webinars you will hear, later on about that. So, so to start with, I would like to, it's my pleasure to invite Professor Amelia Hadfield to open this webinar and introduce our webinar speakers. So Amelia is our Dean International at the University of Surrey since January 2021. And she's leading the International Engagement Office in supporting the strategic goals of the university on partnerships and other universities and networks worldwide, enhancing the cutting edge research cooperation as well as the staff and student mobility. She joined the university in Surrey in January 2019 as the head of the Department of Politics and chair in European and International Affairs. Previously, she worked as director of the Center for European Studies a Jane Monnet Center for Excellence at Canterbury Christchurch University, after positions in Brussels at the Vrije University in Brussels and the Institute for European Studies, where she directed the Euromaster degree as well as the educational development. I can keep talking about her. She got a lot actually, to talk about. But in the interest of time, I will just hand over to Amelia to say a few words and open this webinar and introduce our speakers.
Prashant, thank you. Absolutely. We're not here to listen to my credentials. We're here to talk about the incredible work that you are doing and your two colleagues. So it's my great pleasure as Dean International to formally open the Global Indoor Air Quality and Respiratory Infection webinar. The amount of work that has gone into this, particularly by Prashant, is absolutely astonishing. And the ground that he has managed to break, I think from scientific perspective, but also the enormous amount of heavy lifting to get those contacts together is truly astonishing. And I commend the work that's being done here. So as Prashant rightly said, air pollution is a major environmental risk. We're just less than a week past the end of COP, and the idea of air pollution outside as well as indoor air, both of those I think were highlighted not just through COP, but became in fact even more salient during the pandemic, when people spent a majority of time indoors. So the idea, I think, of air pollution is much better understood, I think, from the general public's perspective, but we continue to need scientific development as well. So as Prashant said, this is the monthly webinar series is part of the EPSRC Surrey development, and it supports the ODA, Official Development Assistance Project, called Knowledge Transfer, which is exactly what this is, and Practical Application of Research on Indoor Air Quality, so KTP-IAQ. I've been delighted to see how successful the webinar series has been already in bringing together speakers from a host of our collaborative institutions across the world. You've already seen the map. Partners from GCRF supported care homes and care cities. Care cities is, I think, becoming Prashant, something of a franchise. So it's excellent to see how scaffolded and how well developed it's becoming. And these projects have been incredibly successful in monitoring household air pollution in a variety of low-income cities, 13 cities across those 12 ODA countries. And I'm delighted because I think knowledge exchange platforms are very much the way of the future. It's something that our university does particularly well, but you can never do this in isolation. It's not something that you can do, in a closet. It's incredibly important that that platform is outward facing and that we link with ODA countries with the very real aim of sharing and discussing what we're doing, the state-of-the-art best practices on indoor air quality and respiratory infection globally. It's my absolute pleasure to welcome the two speakers that we're going to have today. I'll do them in order that they're going to be presenting to you. First, of course, Abdus Salam. Welcome, Abdus, who completed his Bachelor of Science in Chemistry and a Master of Science from the University of Dhaka, and a PhD, of course, in Atmospheric Analytical Chemistry in Vienna. He and I have something in common. Abdus, I don't know if you know this, you worked as a postdoctoral fellow at my alumni, Dalhousie University in Halifax, Nova Scotia, which is wonderful, and York University, Ontario in Canada. So lots of overlaps there. He has a tremendous number of collaborations across the world, and including with NASA as well, that have taken him around the globe. And his research interests are on atmospheric chemistry, air quality and impacts on human health, which makes him perfect for this project, climate change and ecosystems. Abdus has also been actively participating in electronic and print media interview. I'm glad to hear that. That's good. You and I have that in common, Abdus. Every time the radio ring or the telephone rings, you know it's the radio. Talking a lot about air pollution causes, impacts, and mitigations. He's also served in very many prestigious international committees, including International Global Atmospheric Chemistry as a scientific member. And our second speaker will be Dr. Shiva Nagendra. So welcome, Shiva. Lovely to have you here. Presently working as a professor in the Department of Civil Engineering at the Indian Institute of Technology in Madras, IIT-M. So that's fantastic. And of course, Shiva has more than 20 years experience in a whole host of areas: researching, teaching, consultancy, community development, published so much that I'm really frankly quite jealous in terms of journals and reference books and papers, etc. And he's the author of the books, many books, most recent of which is entitled Urban Air Quality Monitoring, Modeling and Human Exposure Assessment. I'm sure he'll be discussing that. and in addition, artificial neural networks in vehicular pollution modeling. So he's, of course, a member of a variety of key societies and been part of numerous grants involving multiple national and international partners. I think what you gentlemen have in common is this inherently global approach to how you network and how you manage your research. So it's an absolute pleasure for me to welcome you to this. Prashant, thank you so much for giving me an opportunity on behalf of the university to kickstart the webinar. Thank you.
Thank you. Professor Salam, maybe you can share your screen.
Hi, Prashad. I just try to share my screen. Okay, I got it.
All right.
Okay. Can you see my screen?
Yes, yeah, I can see that. Yeah, you can.
Okay, so I can start now.
Yep.
Thank you, Amelia, for a very excellent introduction, and also nice to hear that you are also Dalhousie alumni. So we have some good connection. Thanks. And thanks also organizer for inviting me for this talk. Today I will try to speak on indoor air quality situation and also some health related connection of the indoor air quality in Dhaka, Bangladesh. The outline of my talk, actually, I will try to speak some background of the atmospheric pollution or air quality issues in Bangladesh, and also try to show some long-term air quality characterization in Dhaka. And then I will go to speak 4 different cases of indoor air quality, like biomass burning in the cooking stoves and indoor air quality in residential homes, and also indoor air quality in the hospitals and in the school environment in Dhaka, Bangladesh. The background of Bangladesh, you know, Bangladesh is a very highly populated and polluted country. And mostly the country was, depend on agriculture, but now it's moved from agriculture to industry. And it's also, nowadays recent very high GDP growth. Winter time air quality in Dhaka, Bangladesh is extremely poor, especially from November to February. And the PM 2.5 levels goes up to 25 times with a new 24-hour WHO guideline. And only very few days, especially in the monsoon time, June, July, August, people are getting relatively clean and fresh air in Dhaka, Bangladesh. People are talking about the 1.5 degrees Celsius global temperature rise. What will happen? This is a big disaster for Bangladesh, because most of the southern part of Bangladesh, it goes underwater, and then about 41 million people maybe need relocation. And severe air pollution in Dhaka causing severe health problem. And in Dhaka, about 21 million people are living, and they have various health-related problems due to the severe air pollution. And the cost for that is about 7% of the GDP growth of the country. And cooking with biomass with very inappropriate ventilation has seriously impacted the indoor air quality in the homes in Dhaka and also overall in Bangladesh. There was a report, maybe you guys noticed, the environmental impact in many countries of the world. Lancet did a study, and top 10 countries with United States and United Kingdom, Bangladesh is the number 1. And about 26% people are died due to environmental problem. And out of this 26%, 75% people are died due to air pollution. So air pollution is a really serious issue for Bangladesh. I think for the world nowadays, but especially for Bangladesh. And if you see the left-hand side picture, you can see the air pollution in IGP region. And the left-hand side picture shows roughly the chemical composition in this whole IGP region in Delhi, and then in Bangladesh, then in Hanimado. Black is like total carbonous species, and green one is anthropogenic water-soluble inorganic species, and red is non-anthropogenic fraction. So most of this kind of chemical composition and whole IGP region. If we see right-hand side picture, we can see the air mass coming from Bangladesh, especially in winter time. And this is AOD based. 75% air mass is coming from IGP region towards Dhaka, especially. So we have our own pollution, and we are also getting a lot of dirty air from IGP. So that makes the situation in Bangladesh, especially in Dhaka, really horrible. And this is the long-term PM 2.5 in two different cities in Dhaka and Kolkata last 8 years. If you see almost the similar pattern shows every year, and there is no indication for the reduction of air pollution in these three cities. One is actually 7 days average of PM 2.5 is Kolkata, Dhaka, Bangladesh. So if you see the same pattern within a year and in different months, what is happening actually? If you see the middle one is monsoon, June, July, August, this is really low. And September, October, November, pre-monsoon and post-monsoon is also kind of elevated concentration of particulate matters, PM2.5 especially. If you see January, February, and the other side is December, it's really huge. Even in monsoon time, the PM 2.5 is above WHO guideline value. I think the old one, the new one is even much lower. So this is the situation and the variation of PM 2.5 at different months in Bangladesh, in Dhaka especially. And if we look other pollutant like sulfur dioxide, nitrogen dioxide, and carbon monoxide, for the last 17 years, 2003 to 2019, if you see sulfur dioxide concentration is getting higher and higher, and NOx also. So these are the fossil fuel based, I think, pollutant is concentration is getting higher and higher. And ozone is typically depends on different other things, secondary pollution. So it's more like constant, and CO concentration also getting higher. And the same pollutant, if you look annual basis, like monthly basis, January, February month, and we see the similar pattern just we saw for PM 2.5. June, July, August is low, and January, February, and December is the highest one. So similar pattern is followed by this pollutant like PM particulate matter, PM 2.5. This is another interesting picture. If you see that the concentration of particulate matter during the day, different times of the day, and it's most of like same during the night time, and only middle of the day the concentration is slightly lower. If you see the other graph, you see the boundary layer height. Only middle of the day, 10 to 16, the boundary layer goes up, then the pollution goes down. But the rest of the time, boundary layer is very low. And that's why the pollution during night time is much higher than daytime in Dhaka. We can see the boundary layer goes higher. And also there are another issues there, like heavy duty vehicle operating only in the night time. And the overall sources of air pollution in Bangladesh, in Dhaka or in Bangladesh, if we see, we can, this is PMF, positive matrix factorization. We saw main sources for air pollution like traffic emission, road dust, biomass burning, and industrial emissions. There are two other sources for air pollution in Dhaka, like brick kilns. There are about 800 brick kilns near Dhaka city. and another one is transboundary air pollution. So these 6 are the major sources of air pollution in Bangladesh or in Dhaka city. There are some other sources also too. My next couple of slides, I will speak 4 different cases for indoor air pollution. If you see the rural area, mostly the houses are like this, and they are cooking there, and on the top, this kind of solid materials deposited, and we collected these materials and analysis for some heavy metals, and we found their concentration are really high. And these are the typical cooking stoves in the rural area or in the street area people using in Dhaka or also in Bangladesh. And we also planning to see what kind of biomasses are using for the cooking. So we select several biomasses and we bring them in the laboratory and we burn them in exactly typical cooking stoves in the laboratory, and we collected the filters and we analyzed for their chemical composition. If you see the chemical composition in this table, and this is really high metal content and other sulfate nitrate concentration we obtained from this biomass burning. And we also did black carbon, brown carbon analysis from them. And this is one picture like brown carbon concentration with methanol and water extraction. And we found some biomass emit really less and some are really high. I will not speak everything. We also did mass absorption coefficient calculation from this. And we also determined total organic carbon for these biomasses. So we found a very high concentration also for total organic carbon. There is another indoor air quality study we did in 5 different regions in Dhaka city. And we tried to cover the whole Dhaka city from from south to north. And we use, we make some assessment how we will get the more exposure or overall picture of the Dhaka city. And we collect filters and we also collect real-time samples. And we did chemical analysis, and we also did their PM 2.5 and other real-time measurement. We found these are the concentration in different areas in Dhaka city, different homes in Dhaka city, and you see none of them below WHO guideline value. All of them are above the WHO guideline value, even PM1 to TSP. We did all different particle size fraction with our aerosol device. And these are really high compared to WHO and other values. And then we did total hazard ratio indicator. If you see by using this equation, it is good if we get it, this value is like 1, but most of the cases we found is 7 to 10. So which is very alarming for Dhaka city. It should be 1, but it is like 7 to 10 times higher than this reference one, Dr. ITL 2007. And we also try to compare with the fine particulate matter, the peak flow rate. We use peak flow rate to see their lung function efficiency. And we found lung function efficiency is compromised when the particulate matter concentration is really high. So this is the situation from indoor homes we did in 5 different areas in Dhaka city. And we also did the similar kind of study in the hospital environment. Hospital is very important for the patient. People went there for becoming, cured. Rather, if they get the exposed very high concentration, high pollution inside hospital, that aggravate their disease rather than curing them. So we select many areas of the hospital, 2 big hospitals in Bangladesh. One is Dhaka Medical College, another one is the Bangabandhu Medical University. So these 2, and one is the rural areas hospital. And we sampled different areas of each hospital, like children's surgery ward, operation, department of cardiology, respiratory, and also emergency department, pharmacy, all the possible location of each hospital we did sampling. And we try to analyze those samples, and we found in all cases the indoor versus outdoors ratio is really high. So it indicates the outdoor air pollution has a serious impact indoor air pollution. And we also determine toxicity potential. Toxicity potential is the concentration, what we obtain compared to the standard value. And we calculated PM 2.5, PM 10, PM 2.5, and PM 2.0 in both seasons, in post-monsoon and also during winter time. And none of the cases we did not find the ratio is 1. And all the cases we found is above 1, especially in the winter time. PM toxicity for PM 2.5, the toxicity ratio is above 10. So it's really very bad situation even inside the hospital environment. So we should be, our government should be careful about the hospital things, for the even indoor air pollution cases. And we also did similar kind of study in the school. We select 10 different schools in different parts of Dhaka city to cover all the area in Dhaka city. From the picture you can see. And in 10 schools, we select 250 children, and they are most below 12 age, and 115 boys and 135 girls. So we try to measure both inside and outside air pollution or particulate matter concentration, and we also did the different trace gases inside the school. This picture, you see the left hand side is the concentration of the particulate matter of different sizes, and then this is for indoor one, and if the outdoor one is the right hand side. And if we see the concentration both indoor and outdoor in 10 school, S1, S2, the like number of school. In all cases, they are really very, very high concentration we observe even in the school environment. So kids are really exposed very high pollution level in the school environment. And we also sample like classroom, administration building, and also outdoor playground and different parts of the school. And we see the correlation among them, though the correlation is not so strong, but for very fine particles matter, the correlation is very strong between indoor and outdoor. But for these two size fraction is not so strong, the correlation, but still it indicates the very fine particulates matter has strong influence from outdoor air. And also in the school, chalk and other educational materials also produce a lot of dust. So it has indoor pollution and also coming pollution from outdoor. So it has a lot of influence on the kids. And after that, we try to check the lung function efficiency of the school children. And we did it for about 250 kids. And we found about 50% of the children, they have difficulties for their lung function. They should pump and there should come a disease, and it's like above 300 it should be fine, but more than 50% students are not able to do that. And we also try to correlate between this lung function efficiency peak flow meter reading with the school particulate matter concentration. In some cases it good match, but in not most cases it good match. But still we observed the lung function efficiency of the kids in the school environment was compromised due to the particulate matter concentrations. So my conclusion is strong seasonal variation of the particulate matter and other pollutants with very high values in Dhaka. And outdoor air pollution has a strong contribution to the indoor air pollution, even in the hospital environment. And pollutants are much higher in indoor than outdoor in the school. And indoor particulate matter showed a significant correlation with the lung function efficiency in the residents of those whom we take data at 5 different regions in Dhaka city. And hazardous ratio is about 10 times higher in indoors than outdoor. And toxicity potential is also 10 times higher in the hospital environment than outside. And we found 50% kids in the school and their lung function are compromised due to high pollution or particulate matter in the school environment. And this is our group members. So, I have a very big group, and most of them are working on different small issues on the air quality in Dhaka city. And finally, I gave you thanks for giving me the opportunity to give a talk here. Thank you all. So is there any question? Maybe I can respond later on. Thank you, Prashant.
Yeah, thank you very much, Professor Salam, for very interesting presentation. We have some questions, but we will pick that up once we have the next talk, finished. So please, if you have any questions, please use the Q&A, the button, and put your questions there. So over to you, Professor Shiva Nagendra. So maybe you can share your screen.
Thank you, Professor Prashant, for giving an opportunity to share our, experience and transfer the knowledge what we gained in India in working in indoor air quality subject. So this talk, I will going to focus on indoor air quality management in microenvironments. We started indoor air quality research almost more than a decade, and there are 4 PhD students who already awarded, Dr. Lakshmi, Dr. Dipti, and Dr. Chitra. So I will going to share their work, and also the young researchers who are currently working on and their topics are also I'm going to talk in this particular series. So let's my talk. I was just wondering when we try to look at it, indoor air pollution. People will spend about 85 to 90% of the time in indoor environment, but in the current situation, I am sure that more than 99 to 100% we are at home in last 1 year, and thanks now we are just going back, and sometime we are working in the office and other places. So now I will going to share what Professor Salam has shared. So I'll also try to talk about some indoor air quality characteristics in classrooms. And then we will also try to understand some of the aspects in rural households, then urban households, and subway micro environment. This is another research which we are currently working on. Then we also try to share some of the experience we gained in understanding exposure deposition and their modeling in different environment. And then we will try to bring out some technology development in order to address indoor air pollution. So my first talk, since all of you now, because attending this lecture series, I'm sure that you are all aware of it much more than what I'm going to talk about the basics of indoor air pollution, what are the sources that contributes indoor air pollution, which is critical. So all those basics and human comfort aspect, you are already aware of it. I'm going to touch upon only on some of the case studies where you will get some insight into the different aspects of indoor air quality. So now you like to see the schools sometimes either in most of the cities, because of the schools, the traffic adjacent to the school will be increased, or because of the nice highway or good roads, then they will also plan a school in that. As a result, the outdoor air pollution, particularly the contributed by the vehicles, will contribute significantly on the indoor environment. So this is our first study. We started looking into how the outdoor air pollution influencing on the indoor air quality. If you try to see the graph, generally the large size particles will be much higher in the indoor environment, just basically because of the student movement and then resuspension activities that are going to contribute. But if you see that the smaller size particulates concentration, particularly PM1 and PM2.5, you will notice that both the indoor and outdoor environment will have good correlation. And sometimes you will notice the indoor concentrations will be much higher when compared to the outdoor concentration. As a result, you are exposing to the higher concentrations of the indoor air pollution when compared to the outdoor air pollution because of the poor ventilation. Now, when we are doing this work, the principal asks a question: is it possible to address this particular problem? Then we try to look at it. Is there any way we can look at it with existing facility? How do we control this exposure? How do we limit this exposure? So one aspect is, if the pollutants are transporting from the outdoor environment to indoor environment, then why don't we control that? Maybe we can, by operation of the windows during the peak hour, can we close that windows and then try to see whether it improves the indoor air quality or not? So in that context, when we try to look at it, then we did a CFD simulation, creating the actual classroom and understand the emissions coming out from the indoor to outdoor, also from the outdoor to indoor environment. And we did several scenarios. And then we noticed that there is a possibility up to 20 to 30% of that pollution can be addressed by operating the certain windows within the classroom. Then we also try to look at it, there is a possibility of understanding which source is significant in the indoor environment. So we looked at, and we did a source apportionment study similar to the previous speaker, which he mentioned. So the diesel exhaust was contributing in the indoor environment up to 24%, and the dust particles were contributing about 40 to 50%. And we also noticed there is a significant amount of chalk dust is also contributing in the indoor environment. So this was the initial study, which was helped us to focus more on indoor air quality research. Then we try to look at it. Is there any, how do we look at it, the indoor air pollution problems in the rural? For example, as in the rural areas, they completely depend on biomass. And thanks to our government, now most of them will get an LPG. But in some rural areas, because of the economics, they will try to operate on the still biomass. As a result, biomass contributions to the indoor air pollution is significant. Now, if you visit rural areas, then you will notice there are different types of kitchens will be coming. Just like in modern urban environment, you will also find different types of kitchens in the rural houses. So there are different types of houses, like kitchens, including like an indoor kitchen without partition, with partition, separate enclosed kitchen, outside house, open kitchen. So you will find out different types of kitchen. So then we try to look at it, what will be the indoor air quality characteristics in the different types of kitchens. And if you try to look at it, the indoor kitchens with partition will have more concentration, basically because of the poor ventilation. That is one of the reason. And we looked at, in general, people who are using biomass will have more concentration when compared to sometimes biomass and LPG. For example, some of the small cooking activities, they use LPG, but large food preparation, they still continue to use biomass. And people who completely use LPG were having less exposed to the indoor air pollution. So this is an outcome from the study which we have carried out in the rural household kitchens. Then jointly with Prashant, we initiated understanding the indoor air pollutions in the in the urban households. This is quite interesting, and probably we carried out this during the pandemic, and probably we need to look at it a little more closely and all the results. And one of the outcomes from this study is, again, if you try to look at it, it is in a rural setup, and most of the places we notice the concentrations are not much exceeding the standard. But if you try to see that during the cooking activities, the small size particulates concentrations are increasing. So it means that there is a significant amount of pollution will be contributed because of the cooking activities. In particular, the researchers also noticed, recorded that during the frying activity, the concentrations are increasing. So that is one of the observations when we are trying to measure the indoor air quality in 5 homes in Chennai for about 7 days in each home. Then that is in the rural in the urban households, and now we are trying to look at those data in a little more detailed way and understand how the different ventilation aspect and other environmental aspect influences the indoor air quality. Now, recently we started looking into the indoor air quality in the metro stations, and particularly if you try to see that, and metro is another mode of transport, and we will spend again completely in the closed environment. In the most of the earlier studies, if you try to look at it, they focused only on particulate matter. But recently, if you try to see the volatile organic compounds and bioaerosols, and particularly in the current situation, the bioaerosols concentrations plays an important role in understanding how they are dispersing in the indoor microenvironment. So there are various factors which controls the indoor air quality in the subway. For example, temperature, humidity, and airflow. Sometimes most of the metro systems will have an air conditioning system, and they will try to operate depending on the comfortness required. So ASHRAE has recommended some guidelines for different parameters, like for example, airflow should be 8 liters per second per person. Then you have a relative humidity up to 30 to 65%, and temperature should be around 23 to 26 degrees centigrade. Then you will notice that within the subway station, you have a different types of tunnels. So sometimes you will have a platform on both the sides, and it will be partitioned by a wall, or there will be only one platform. So you will, as a result, you will also noticing a complex environment and geometry in influencing the indoor air pollution in the subway station. For example, depth of the platform from the ground level, then train movement, the frequency of train movement, the occupancy level, and also the air exchange rate. So all these aspects are influencing on the indoor air quality in the metro stations. And more details are available in one of our review paper, which got published very recently. Then we try to look at it. One of the aspects is to understand whether if passenger spend some time in the indoor microenvironment, and what will be the deposition. So try to look at it that aspect. So now we looked. There are some stations which are above ground stations. Some stations are underground stations, and some stations are at level stations. So we try to look at it above ground station and underground stations, and also during the journey within the inside the train. So if you try to look at it, mostly underground stations will contributing much pollutant concentrations in terms of the particulates measurements. But when you try to look at it inside the train, of course, inside the trains, the conditions are much cleaner. As a result, the exposure levels will be very less. But even now, we try to look at it, what will be its particulates deposition in the different respiratory tract, for example, head region, trachobronchial or pulmonary region. And if you noticing that the significant pollution will be getting deposited in the pulmonary region, which is of greater concern. Even if you try to look at it, even in the summer and winter season, so there is a significant pollution which are experienced by the metro station, and also deposition on the human exposure. Now, this has led to we started working on this, try to identify some control technologies that can be useful for particularly this kind of an micro environments. So one of the idea which came to us was just like looking at our water purifier. You might be knowing that. So generally, each house will have a water purifier, which is having a component of filtration. Then you have a pre-filter, then activated charcoal filtration, then you have an UV radiation in order to address both the suspended particles or turbidity, and also the smell component or a gaseous pollutants, and then with the your microbial components. So we try to look at it, the similar concept, and try to bring out the same aspect in our initial design. This we started about almost close to 10 years back. And then we designed an air purification system, which is similar to your water purification system. And we also tested this when, with the filter, air purification system, without air purification system, how the particulates concentration and VOC concentrations are, changing. And as you notice, there is a significant reduction in, particulates concentration when the air purifier was operated. Now, this was, then we started looking into, is there any way we can improve the filtration mechanism and also addresses some of the VOCs which are, emitting, particularly in the indoor environment. You will also notice there is a smell will be another problem, and most of the smell is happening because of the volatile organic compounds. So we did, developing a filter material, which is a combination of chitosan, activated carbon, and TiO2, which blended in a different proportion, and we developed a filter. And the filter was tested for its performance and its stability, and it also got published in one of the referred journal. You can see more details in that. And then we use this filter in developing an air purification, and we got a patent recently, and now we are looking this product to address the air pollution in indoor environment, particularly in the office space, hospitals, and also in the conference room. So one of the key feature of this is it also addresses both particulates, gaseous pollutants, as well as microbial, or bioaerosol components, which includes the pandemic causing bacteria and viruses. So currently, its flow rate is about 530 meter cube per hour. Which we tested in the laboratory condition, which controls an area about 50 meters square, and overall efficiency is good for PM10, 2.5, and TOC. Okay. Now we started looking into addressing some of the similar technologies in terms of ambient air purification. Also, this is another dimensions we try to look at it, because if you try to look at, we need more engineering solutions, because already problems are there. We understand more characteristics. We wanted to find out what is the solution. So we looked at, this is also another aspect, and now currently we have made 2 such products, and we are under testing. We call this as a cyclofine, which includes removing some of the large size particles apart from gaseous and small size particulates in the ambient environment. Okay, so in addition, we also try to look at it. There are other types of pollutants. For example, in the urban environment, you also notice large scale DG generator sets will be there, and they will contribute significant amount of pollution. So we developed a technology which can be effectively fit into these kind of an exhaust, particularly from the generator sets. So, which is very effective in controlling both the soot particles as well as some of the gaseous pollutants. And we have tested in few industries, and the results are promising. Now we are taking this product to a commercialization. Now, in addition, we also try to look at it. Road dust is another major issue, and as you try to look at it, even in the classrooms, the sweeping is required in order to clean the large amount of dust which is getting deposited in the school environment. So we come out with a road dust collection, because sometimes the existing mechanized road dust collection may not be able to move in all the spaces, because some of the narrow space, then it's a constraint to take this vehicle. So this will be a very compact, and it can be useful for collecting the road dust or even the dust deposited in the indoor spaces. Okay, so now I'll give some aspects which we are also collaborating with Prashant and other members in the SIPA network, which is also supported by UKRE. to organize networking and conferences and workshops. So we, as a part of that, we also initiated a monthly lecture series on air quality management, and you are all the participants are most welcome to join this event. The details can be found in SIPA network. And thanks to all the collaborators, including Professor Prashant. And we also having an international conference on air quality management, which is going to come next month during the same period. You are most welcome to join. And again, it is an online. You don't have to travel. Maybe you can explore an opportunity to listen to all the key speaker. And of course, Prashant and Abdul Salam also going to speak in that conferences. So this is our group. I thank you for your time, and if you have any questions, I'm open to, you can write to me. I will also respond to that. Thank you, Prashant, for the opportunity and also your support for the, clean air, care air homes project. Thank you very much.
Thank you very much, Professor Shiva Nagendra. So I think we will do is we'll take some questions now. I can see that there are quite a few actually, so I'm going to pick actually one by one and see how long we can go. So I think this first one is for for Professor Salam from August McNabola. So it's a great talk on Dhaka air quality. Can you please tell us something about the extent of the air quality monitoring network in the city? And also, if you had any problems with the quality control for use of aeroset monitors in indoor environments with high concentrations humidity, how do you control for measurement errors? So Angus is a colleague actually from Trinity College Dublin.
Thanks. I think it's a great question. Two parts of the question. First part is the monitoring network in Dhaka, then is the quality control of the aeroset device, I believe. So monitoring stations for our government, I think there are 2 or 3 monitoring stations from government. It's like not sensor based, it's a BAM, and they are doing filter based measurement. And from our side, we started covering the whole city by the TSI blue sky sensor. We already installed 6, and we are planning to install 19 in different locations of the city to cover the all kind of environment inside city. So this is the monitoring status in Dhaka city, but overall the whole country is really very, very less. You can say very insufficient monitoring network in Bangladesh as well in Dhaka city. For the quality control of the aeroset device, actually, what we did after certain times, the aeroset device was sent to the manufacturer for the calibration. And we also compared the measurement with filter base. We have once a beta, a Japanese machine, we compare with that. And we also some other real-time monitoring devices. So we compare with that result. If these are like within 80%, sometimes we found 80%, sometimes 70% compared to other device. So we accept that data. So in this way, we control the quality control. There is, I think, another question for the ventilation. I can't hear you, Prashant.
Yeah, I'm going to go backwards. So I have a question for Shiva this time.
Okay, thank you. Thank you.
So this is from Peter Fleming asking about, I see you're using UV in your system. Did you have problems with generation of ozone as a result? So this is one. And then how did you measure TVOC? That's the second question.
Okay, so TVOC, we have used photoionization detector as PID sensors, which is available, and we use that one for detecting the TVOC. Mm-hmm. And yes, when you use UV, there is an always expect that there is an ozone formation will going to happen. But in our case, we didn't notice that ozone concentration significant in the in our air purifier. And also we have an activated charcoal, which absorbs some of this reactive compounds, which enhances the formation of ozone.
Okay, that's great. Yeah, thank you. There's another. So this one is for you, Professor Salam. Do
Yes.
ventilation of buildings play an important role in indoor pollution of Dhaka? If so, how hospitals with central ventilation and filtration systems are also recording so much high PM concentration?
Thank you. In Dhaka, we have two defined kind of hospitals. One is the government and another one is the private one. And government, most of the people you can have access to the government one. And the private one is really clean and well ventilated and central ventilation system. But we did our sampling in two biggest hospital in Dhaka. One is Dhaka Medical, the government one. Another one is the Bangabandhu Sheikh Medical Hospital. It's also government. So in this two hospital, actually there is no central ventilation system. And it has some ventilation, but it's not, I think it's not well ventilated actually. So the situation for ventilation is not so good. Definitely ventilation improves the indoor-outdoor flow and also reduce the indoor pollutions. And we noticed during our sampling, in some part of the hospital, there are, is very poor people coming from the very remote area. They use some kind of cooking for some small heating food or sometimes maybe small cooking inside. So that also increases the indoor air quality. Anyway, thanks.
Okay, thank you. So this one is from Francis Olawale from Nigeria. So he's asking about what's the name of the instrument used for the lung function? Does it make any sense if low-cost sensors can be used for this type of work?
Yeah, actually we use aerosol. It's not actually low cost. It's maybe compared to United States is low. Anything less than 10,000 is low. We used aerosol is like a few thousand, I think, 4 or 5 thousand cost. And we used Rosmax, Meyer, BSMA, different kind of free flow meter, is available in the market. We used like not low cost, medium cost, and maybe some are very high, some are high cost, not very high cost.
So sorry, what was the name of this instrument you said?
Rosimax, and another one is Maya, and some other two.
Okay, that's fine. Yeah.
All the name now.
Okay. Yeah, that's great. Yeah, thank you. I think there's one last question, then I will just close with that because we are running out of time now. Have you any experience with running HEPA filters in classrooms? This is primarily to reduce COVID aerosol, but should also reduce PM in general.
Thanks. This is a very good question. Actually, we saw some paper. They use this and also that improves the indoor air quality. But we didn't do that in our classroom and also in the hospital. We didn't do that.
Just to add to Prashant, HEPA filter, generally they use it in air conditioning system. And in fact, we also use in our air purifier HEPA filter in order to address some of the smaller size particles. So as you rightly said, it removes even bacteria, but there could be a possibility that the smaller size could still escape from this HEPA filter. In such cases, there is a need to look at the UV radiation as an additional mechanism in order to address some of these bacteria or viruses which escape from HEPA filter. But one aspect we still look at it, if there is a pollution load is very high, then frequently we need to change this filter. That's another challenge. As a result, there could be an increase in CO2 concentration within the air conditioning environment because there are low air exchange aspects.
Okay, so I think with that, I would like to thank both our speakers for fantastic talk and giving a very, the fascinating overview within the very limited time we have, and to Professor Amelia Hatfield for, coming and joining us in the beginning. This webinar will be, will be available with the captions on the YouTube channel of the GCARE, and we will also send you an email once this webinar is finished with the link which is readily available. So the next webinar is on 17th of December, 2 to 3 p.m. The UK time, and we got a colleague, our colleague who is collaborator in the care cities, care homes, and this IAQ project, Professor Araya Asfa from Addis Ababa University in Ethiopia. And then we got our new collaborators who joined actually this last project on this KTP-IAQ and the care homes, Dr. Francis Olawale Abuludu and Dr. Adidiji Adilun. My apologies if I haven't pronounced your name correctly. So I will, you can see the link is there in the chat box to register for this next webinars. And we will look forward to see you back again next month. Thank you very much, everyone.
Thank you, Prashant.
Thank you, Prashant, Amelia, and all. Thanks.
Thank you all. Thank you, Aslam. Salam. Thank you.
Thank you.